Hey everyone, Paul Wheeler here at Wheeler Health U. Today is Therapy Thursday, and we're going to talk about kind of a treatment for tennis elbow and some of the things that have worked in the past for some of my clients and some of the things I've learned through my orthopedic massage training seminars. So what you need is you can just use body weight first, and what you're going to do is, let's say there's a point specific spot right here that hurts. You would do the ball rolling techniques that I showed you yesterday for Massage Wednesday, and you would kind of do that because it really preps the tissue and allows, if the flexors are pulling too much, it kind of releases those so that the extensors don't take as much of a load. So the first thing is just to go through a light range of motion, and I'm going to keep this simple just for the sake of the video. And you want to go with that light range of motion without any point specific pain. So let's say during this range of motion there's a little bit of pain there. Very, very light pressure. You just do some multi-directional friction, and that just helps break up the scar tissue, create some inflammatory response, and then what you do is you go back, so you do that for no more than 30 seconds. And again, it shouldn't be like excruciating pain at all. It should be very, very light and soft. Okay, we're not trying to grind away at it because that's just going to irritate it. And then you go back to those slow and see if it's changed. And a lot of times, after doing a little bit of that, the pain is gone. And then what you do is you increase the load. So then I'll grab 3 pounds. If you have something lighter, you can do something lighter. So then you would go into flexion and slow extension. And then let's say right there, again, there's that point specific pain with extra load. So then you would go back and do maybe a little bit deeper, but again, not aggressive, multi-directional friction. Because again, if you do too much, you can irritate, and we don't want to irritate. Okay? And then you would go back and you would retest, and let's say that it didn't help that time. So let's say it's still there. So then you would go back to it, and you do it again. Multi-directional friction, you can go side to side, up and down, circle. Just trying to break up, bring some blood flow, and then this helps to create a more functional tissue. So this doesn't do anything as far as creating functional tissue, it just breaks it up, allows it to release, and then this creates that functional tissue. Okay, let's say that's better. Now you can either stop there and kind of go into some more strengthening stuff, and you can work different ranges of motion. But again, for this video, we'll just work on extension.